So is there any other advice you'd give to family caregivers as far as the surgeries that you're seeing and the post-op? It sounds like pain management can be a little bit of a challenge, but making sure they're going to physical therapy, I know, is so key to get that recovery. But is there any other advice you would share that you feel like, just even in your patients in general, that you would wish that they were maybe a little bit better at?
I would say if you have older patient and you are the caregiver, know what they can do. So you have to really know the limitations and come prepared for that. If they need the help, you have to be prepared to help take care of your aging, parents or loved one, So you have to be realistic about what they can do. Because like you said before, there are different levels of post-operative care. Obviously, the best is the independence one and being home and going to outpatient therapy, but that's not for everybody. So you really have to know what your loved one can do. And so that we can help direct you on where to go. We have great case managers at the hospital that can help navigate you through whether do you just need home health and therapy, or do you need, to have
Home care.
home care, or do you really need an inpatient facility? And there are metrics that have to be met to qualify patients for different levels of care. And we can tease those out in the hospital if they come in for that. But it'd be really nice to know that up front.
Do you have any recommendations when people are looking at an inpatient? They have to do the inpatient care. They have to go to a short-term rehab stay in a facility. Do you have any recommendations for families on how best to choose one?
Don't go to one.
I know.
That's a real recommendation, but no, I think you got to visit. I think the patients have to really take ownership of it and go visit the centers themselves. And like I mentioned, we don't visit them that often. And sometimes I've given talks and presentations at them, but I don't know what the experience is like. You have to talk to people that have been there and get information from the people that in the community, because every community has these facilities. And with our geographic area being so broad, we just get feedback from the patients, and that's good, but the patients have to do that themselves. And I think visiting is great. I always tell people if they need to go to a facility, visit, talk to them. And a lot of times, if you like it, they'll reserve a bed space for you. And so you can go directly into these places.